Welcome to the Acupuncture Outsider podcast. My name is Richard Hazel, and in the time it takes for you to commute to or from work, I hope to have shared something of interest about orthopedic acupuncture using motor points, trigger points, myofascial slings, neurofunctional acupuncture, segmental treatments, anything that crosses my mind that seems to be of interest. I hope you'll enjoy it. Hello, and welcome to another episode of the Acupuncture Outsider. This is Richard Hazel, and today I wanted to talk about using electric stimulation on motor points. It's sort of been assumed, if you've been listening to other episodes, that when I'm talking about treating motor points, I'm using electric stimulation on the motor points. And I thought I would just kind of backtrack and go into like the very basics about it for people who might be new to the whole concept. And then, often I get emails or messages on social media from people asking me about specific devices for electric stimulation of motor points. So let's talk about it. Using electric stimulation on acupuncture needles is not a new concept. In fact, even in traditional Chinese acupuncture, you will find people using electric stimulation on the needles, but the needles are in acupuncture points, so they're not always getting the same result. And if the points were located and chosen because of their TCM function, they're very likely not anatomically relevant to the problem. They're considered to be working on other dynamics for that problem, because the diagnosis of that problem is probably completely different. So, yes, you may have seen other acupuncturists using electric stimulation on needles, but if their location for the needle is not based on anatomy, instead based on a meridian system or a Zhang Fu internal medicine diagnosis, then it's completely different. So let's talk about what we're doing with motor points since about the mid and late 20th century. A different style of acupuncture has developed. Some call it contemporary acupuncture, some call it neurofunctional, some call it sports acupuncture, some call it orthopedic acupuncture, some call it medical acupuncture. We don't have a common terminology. That makes it very difficult for patients who want to find this style of acupuncture. But knowing that the common denominator is the stimulation of motor points, often with electric stimulation, it's important to just mention that, so that when you are looking for someone who does this style of acupuncture, you can ask them if they are treating motor points. And if they say yes, then they are using one of these styles and have been trained to do a diagnosis based more on anatomy and physiology, and hopefully joint range of motion and sports physiology, etc. So motor point is not really a point. It's a region of skeletal muscle that is more excitable than the other parts. So if you were to put a needle in any random location on the muscle, you might get one of those excitable regions, and you might not. If you did not get one of those excitable areas and you put electric stimulation on the needle, you will see nothing, and the patient may only feel a tapping sensation from the electric stim. The electric stimulation is usually at a slow frequency, like 1 hertz. So like a heartbeat pulse, 1, sometimes 2 hertz. So accuracy becomes very important. The depth of the needle is important, because obviously if you're targeting a muscle that is deeper than the first muscle that you get when you pass through the skin layer, then you need to make sure you get to the depth desired to get the muscle that you're trying to stimulate. And you need to be in the motor point or the region that is excitable. So those are the challenges for an acupuncturist who's learning a different approach, because they may have learned point locations hopefully they did learn point locations in acupuncture school, and those point locations don't, unless you're talking about yin and yang diagnosis, you don't care about the depth of the needle. In a more traditional approach, the depth is more looking at yin and yang dynamics than it is what muscle you're in. So the location of the muscle might be palpated, or the acupuncture point might have been found via palpation, but it's different. What they're feeling for usually is a crevice, a valley, the yin valley, whereas often motor points are found on hypertonic muscles. It's more like a yang mountain, and you still need to know what part of the muscle to be in. So motor point locations are important. You can find guides for motor point location from electromyography. They were mapped out for electromyography and for neurology back starting in the late 1800s. So they've been mapped over time, and of course, everyone's body's slightly different. So these guides are meant to be sort of a consensus of where the best locations are to look for these excitable areas of the muscle, primarily for nerve conduction testing, electromyography. But as acupuncturists, we can use those guides and also stimulate the muscle at that point with an acupuncture needle. And it's not always necessary to use electric stimulation. You can stimulate the motor point, the excitable region of the muscle, with a needle, slightly moving the needle, sometimes in a clockwise movement, until you get a twitch. That twitch will have an effect on the muscle, usually releasing some of the contraction in the muscle. But we want electric stimulation for many other reasons. That twitch alone is not going to do things like neuromodulate pain, increase the excitability of the muscle. It will bring back blood flow, just the twitch, and it will release contraction in the muscle, but not as well as when we use electric stimulation on the needle. This is why we choose to do so. And we usually do it at about 1 hertz frequency, most of us, 1 or 2 hertz. You might use a device that looks like a TENS unit, but it has alligator clamps instead of pads. And you clamp the alligator clip onto the needle, and you turn it on and put it at about 1 or 2 hertz. And you slowly move up the intensity until the patient is feeling it and you're seeing some movement of the muscle that you're treating. And you may choose to leave the electric stimulation on for a set amount of time. Sometimes when an acupuncturist is treating multiple patients, they'll just set the device, and sometimes they have a timer on them so that they can go to the next patient while this one is going for 10 minutes or more, up to 20 minutes usually. But when you're really just looking for a release of tension in the muscle, you often are finished with the stimulation in less than 10 minutes. It's probably going to be somewhere around 5 to 7 on a really tight muscle, sometimes much less, depending on the age of the patient. They'll have less accumulated tension in the muscle, and you can release it in 30 seconds, a minute, something like that. We have different devices that we use to stimulate the muscle. And by the way, 1 or 2 hertz is when you're really, it's for most muscles and most treatments. Okay. There are times that you'll choose a higher frequency and you'll choose a discontinuous wave. So you'll have a high frequency that will stimulate the needle to cause a strong contraction for about 3 seconds. And then it stops the stimulation for 3 seconds. And you'll do that on and off. That is commonly used for inhibited muscles. So muscles that have lost their excitability, they've been denervated and they are not firing well. I think of things like a drop foot, or some issues of muscles that have just become super weak because of injury. Could be from a surgery. The quadriceps are well known and well studied for having motor inhibition, especially after a knee surgery. So in those cases, we might use a higher frequency on a discontinuous wave for, again, maybe about 10 minutes. But we have little pointer devices that we use sometimes. The Pointer Plus and the Pointer Excel are the most common ones. The Pointer Plus is set to 10 hertz and it is not adjustable. The Pointer Excel is a device that has a wheel going up to about 16 hertz. So you can adjust it accordingly. And sometimes we're using that on just one needle to release one muscle in specific. I tend to use the pointer a lot on muscles where I feel it's safest when my hand is pressing down on the muscle next to the needle, and I don't want to let it go and just pulse on a machine because it's close to the ribs or something else like that, where it would just be uncomfortable or slightly risky to let the needle just sit in the muscle and stimulate it. If I'm right next to the ribs, like for serratus anterior release, I want to control where the needle is at all times. And I don't like the idea of it just pulsing right next to the ribs, where we can't see the tip of the needle. So then we're going to use the pointer. We're going to use the handheld one needle at a time pointer. I sometimes feel like the input from the pointer is a bit stronger and better than some of the devices that will hook up. It's probably because we're pressing on the muscle. We just get a much stronger contraction. But I'll use that pointer to test my locations before hooking up a machine, or like I say, for single needle treatment for certain things. The devices that you can get, I have a Japanese device called the ITO. It's an ES130, very solid, high quality device. It's a big favorite in the Canadian contemporary acupuncture world. I think McMaster probably started using them first, and then we all kind of learned from people who did McMaster training and saw their devices and started using them. It's a very solid device. The other ones I have. Let's see. I have Pantheon. I have a Pantheon Pens 12 that I like very much. It's high quality, made out of California. I've tried some other devices. A lot of the ones made in China are not very good because the electric output is not reliable. Meaning there are times when you turn on the power or turn off the power and it shocks the patient. It sends out a blast of electric stimulation really quickly. And you don't want that because it's very jarring to the patient. The higher quality ones that you're going to pay several hundred US dollars are going to have a very solid, stable wave, which is better for your patient and very likely just more reliable for a treatment. You can get inexpensive ones though, under $100 US. And if it's your first device, I'm not going to say don't get it. At least have something to start with. But hopefully, as you move forward and start doing this more, you'll invest in a higher quality devices. So, so those are the units I use. The Ito does not have a waveform. You can't choose a discontinuous pattern. You're just going to turn it on. So it's either on or off, and you can choose from many, many frequencies going up in the 200 range, I think. It may even go higher than that. I never used higher than that. And the Pantheon is very flexible because it can do discontinuous, and it can do, the one that I have can do mixed, where you've got two different frequencies going. Or you can do the continuous, which is going to be like the 1 hertz or 2 hertz, whatever you like, solid wave. So those are the ones we're going to use for releasing contracted muscle that's tight from overuse or injury, posture. Then the higher frequency is often used for inhibited muscle that you're trying to wake up, basically, get it to be more excitable going forward. So sometimes you want to use that higher frequency. Most of the time, I'm not doing electric stimulation of the points for more than 10 minutes. However, when I'm thinking about neuromodulation, I'm less worried about motor points. I'm looking about maybe a segmental treatment, and I'm not necessarily putting the needles very deep. I'm just going past the skin and the fascia, just enough that the needle will stand up with a clip on it. Then I might do 20 minutes. Because of neuromodulation, you can do a lot for pain when you're just using electric stim for neuromodulation. You get neuromodulation whether you like it or not. Hopefully you like it, because it means the pain is gone. But you'll be treating a muscle that's very sore. You put the needle into the motor point, the muscle is sore. The first 30 seconds of electric stimulation with the muscle pulsing, they may feel it, and it may be a little uncomfortable. And then within 30 seconds or so, the pain starts to go away. The electric stimulation has reset the area, and the pain chemicals are gone, and it starts to feel very good. So, and that's, I mean, it's a good thing, but it can be a little tricky, because sometimes the patient gets up and they feel amazing, and it's only been neuromodulation that has made them feel amazing. The imbalance, the muscle imbalance, may still be there, and you'll find out on the next visit how much of the pain relief was because you were on target and you had the right assessment and you treated the right muscles. And then what didn't release? It either didn't release because they're older and they have a very tight, more fibrotic muscle, more type 1 than type 2. And so that it may just be that you were completely correct in your diagnosis, but they need more treatment. It could be that you neuromodulated a muscle that's full of trigger points and it's still too tight, but you got the pain out of it. And now it hurts again because it's trigger points that you need to resolve with, a dry needling technique to get the trigger points to twitch with just a needle to release the trigger points. So then you'll find that out when they come back. You'll know if you needed to do that. And then what you'll find, because you can neuromodulate, if you did some dry needling on somebody, and let's say they're older and their healing time is slow, and you were working on the piriformis because they have chronic sciatica, they may come back with some pain still in the piriformis, but less sciatica. And you may choose, because it's only been a week and you know that their healing time could be up to maybe 10 days or 14 days, you're not going to do trigger points that time. So then you choose to just use the motor point in the piriformis, and that electric stimulation will get rid of the pain that they walked in with. You'll have cleared that pain, that post-treatment pain, and you may find out that you're done, that they're better. because the pain they came back with after this first visit, where you maybe had to do some trigger point release, will be gone. They'll feel better, and thanks to electric stimulation. So electric stimulation of motor points is really fascinating and helpful. I believe that the electric stimulation of motor points for the suboccipitals is why migraine patients do so well, because they've had chronic entrapment of those occipital nerves by the suboccipitals, meaning the nerves are extremely irritated. The surrounding area is full of acetylcholine, which is an irritant, and they end up in this vicious cycle of pain and entrapment. And the electric stimulation can neuromodulate the pain, release the muscles, the suboccipitals that are entrapping the nerves, and then they're basically reset to zero. They're back to where the muscles are healthy, not entrapping and irritating the nerves, and you've calmed down those irritated occipital nerves. So you get this great break of a cycle that that gives them long-lasting results. And I've been very happy to see how many migraine patients I've been able to help with electric stimulation on the motor points of the suboccipitals, and of course the semispinalis capitis. There are other things that I've talked about in other episodes, but I believe that is the magic. I don't know if I could get the same lasting results for a migraine patient without the electric stimulation on the suboccipitals. I haven't tested it because I don't want somebody to needlessly suffer more headaches if I know what works is using the electric stimulation. And just my experience with tight muscles, especially ischemic tight muscles, is that electric stimulation is going to get the job done very quickly, where leaving the needle in without electric stimulation can require more needle time, usually at least 20 minutes, just to get that muscle to release. And it may have only relaxed, but not completely reset. So I like the electric stimulation. I feel I can trust the results are repeatable and good when I'm using electric stimulation, just at 1 hertz for 10 minutes for the headache patients. So what else can I tell you? Okay. Over time, what I can tell you is that my ETOs that I own have never needed replacement. So I can just buy more and have more. Whereas I've gone through many other brands of electric stim boxes that I no longer have because they died. The Pantheon I've only had for a year. So I can't tell you how long it'll last, but it's a quality box. I expect it to last a long time. When I was at Pacific College in New York City, our student clinic used Pantheons, and they had lasted many, many years. The ones that they had were solid, and they had 4 leads on them. So they were, I think, a Pantheon 8 or something like that. Those were solid, so I know they've lasted a long time. The cheaper ones are not going to last. But if it's your intro to this style of acupuncture, then, go for something you feel like you could afford, that's, doesn't feel too risky for you, and start with that. But know that there are better devices that will last. The pointers, I'm sad to say, do not last. I have a pointer that I don't bring to the clinic because it's not completely reliable on when it turns on and off. I have to flip the positive, negative switch when it's not giving me electric stimulation, but it still works. And I've had that for over 10 years. The other pointers that I've been buying in the past 5 or 6 years have only lasted me a year or less. So I don't know what happened. I think they went with a different manufacturer. They went with a different what are they called? Warehouse or whatever in China. And they are much lower quality than they used to be. So they could be $130 or $140 US and only last you a year or less. I have a Pointer XL LT that's the light blue one, the teal blue, and I think it worked for maybe 3 or 4 months. I haven't thrown it away just because it makes me angry that I have to throw it away so soon, because it just stopped giving me a solid input. I have to tap on the intensity wheel just to get a connection, just so that I can use it. And it's really a pain in the behind when I'm trying to treat somebody and I can't get the thing to turn on. So, like I said, I haven't thrown it away because it's like, I feel like I'm at that point, I'm like, that's when I truly lose my money. But, but it's just a paperweight at this point. It's useless. I just have it. So I'm very disappointed with those pointer devices. I used to tell people don't buy the AliExpress ones for $30 US, or 25 euro or whatever, because they're probably cheap. But I'm at this point, I'm going to say, why not buy the AliExpress ones? Because at least if it's only going to last you 4 months, you're only out like $25 and not 125. So I've changed my mind on that. And if you want to buy the AliExpress ones that are all knockoffs, fine. It's probably the same exact device that I paid $140 for. So just, if you want to do that, you'll see they're called like acupuncture pen or acupuncture stimulator, point stimulator, or something like that. Um, so yeah, that's pretty disappointing, but I'm sure many of you will chime in that you completely understand and agree. They've gotten way worse, not nearly the quality that they used to be. So I think that's it. I think I've covered everything that I wanted to. I would just say, um, I don't worry too much about which one is black and which one is red. They say the black lead is a little stronger, so if there's 2 points that you're treating and one is more important than the other, maybe you put the black lead on it. But I think they're gonna both move, so I don't think it really matters that much. Um, when Dr. Craig developed the PENS treatment, percutaneous electric nerve stimulation, and at the spinal segments, he did put alternating black and red. So let's say you're connecting to two needles at like, I don't know, let's say T1, and you put the black on the left and the red on the right. Then at T2, you would reverse that and do black on the left and then red on the right. I think that's what I just said. Anyway, you reverse it so it's black and red and black and red and black. And I don't know that he said there were any set rules like that it was good, the patient would blow up or it won't work. But I think he did do that just because of thinking about electricity and, you want black and red, black and red. Um, there are some contraindications for electric stimulation, like don't use it on people who have a defibrillator pacemaker. If they have a pacemaker, you need to make sure from the device maker, from their cardiologist, that it's okay to use electric stimulation, at least in the arms or legs. So get that in writing to protect yourself. But very often the newer models of pacemaker are not going to be disrupted by an electric stim device like this. People with spinal stimulators need to be able to turn off their spinal stimulator to be treated with electric stimulation. They say it's not a good idea to cross the leads across the heart area. So then, you're not sending electric signals too close to the heart. Though we do cross the spine very frequently without any issues. But I think they say don't put them on opposite sides of the chest or opposite sides of the mid back where the heart is. And what are someone's probably going to tell me, no, that's been debunked. But I'm just saying, like, I don't, because there are certain contraindications, like with pacemakers, where you're not allowed to do it. So I figure if it can interfere with a pacemaker, then it can interfere with the heart rhythm on some people. So then what are the other contraindications? You're not supposed to use electric stimulation on any tissue that's injured. You shouldn't be needling into swelling anyway, but you shouldn't use it on anything that's injured. Um, Big precaution using electric stimulation on anyone who is still battling cancer and they have an immune system that's not good. I personally think acupuncture is probably a risk for someone like that, just because this very slight risk of some sort of infection. I don't treat anyone with uncontrolled blood sugar, type 2 diabetes, anything with necrosis, anything like that. Obviously, no electric stim. I'm not even going to treat with acupuncture. Um, those are the contraindications I could think of. Don't just use your common sense. Don't treat tissues that are not healthy. Don't treat patients that don't have an immune system. Don't treat anyone where the risk of infection is going to be an emergency room visit. An electric stimulation. Pregnancy is obvious. Almost everything is contraindicated during pregnancy, right? So you can't use electric stim on pregnant women. The things that I've read are that it's not a concern for the fetus; it's a concern for premature um, uh, contractions. Causing them to go into labor. So we don't treat pregnant women with electric stimulation. What else? So I have read that you're not supposed to use electric stimulation on any numb area. But I have to say, if you don't do that, they will be numb. They will continue to be numb. So while someone has, now I can't say I've treated anyone who's completely numb. Usually they have very little sensation, but they can feel pressure. I'm thinking about foot neuropathies. I will still treat foot neuropathies with needles in the feet, knowing that they have a significant amount of numbness. And it's essential for all the reasons I've mentioned in other podcasts about treating feet and foot neuropathies. But I think the concern is if they have no sensation, you could have it too strong and you could cause, I don't know, soreness or I'm not sure. But you can't treat neuropathy without getting the needle somewhere in the limb that has diminished sensation. So I do it, and even though I've read that that's a contraindication. So that's that. Anyway, so for those of you who have not heard any episode before, go back and listen to some of the other episodes about things like migraines, and I talk more about electric stimulation on a lot of the other episodes, so you can check that out. But basically, I call this style motor point acupuncture because that's the common denominator, is we're using the motor point, which is an excitable part of the muscle. And so you may see other people calling it different things. I have not trademarked a name. I don't believe in that sort of thing. Even when I was learning orthopedic testing in school, I was annoyed that orthopedic tests were named after people. I thought that was the height of vanity and narcissism. So you're not going to see me naming something. I just think that's kind of crazy. It's, when you're talking about the human body and you're talking about science, you're talking about observable patterns in nature, like the existence of motor points. How can you name something about that? That's just kind of crazy. So, I don't have a specific name for this kind of acupuncture either. I tend to call it motor point acupuncture, and I try to explain to patients that I am treating the motor point or the excitable part of the muscle as opposed to a Chinese acupuncture point. But yes, and some of you are going to say, well, acupuncture points are motor points. And I'm going to say, well, that's true. But do you choose the motor points that I choose for what I'm treating? Or are you choosing based on a traditional medicine diagnosis like blood stagnation, chi stagnation in XYZ meridians? And now you're choosing points at the opposite end of the body to treat those meridians and not going anywhere near the problem. That is different, and I'm not doing really technically a local treatment either, because I don't put needles into the knee for knee pain. I do put needles into, shoulder muscles for shoulder pain, but I'm not going into the shoulder joint. So I don't consider it that local. I'm treating things that affect the shoulder joint. And that could be things in the mid-back. It could be in the lats. It could be in the biceps or the triceps. So, though many people who do traditional acupuncture call what I'm doing a local treatment, I'm going to say sometimes it's pretty close to the area that has pain, but it's still not going into the site of pain. So that's different. But I do not use an internal medicine diagnosis to choose my locations. I'm trying to restore joint mobility by treating muscle imbalances that are causing friction, pain, inflammation, nerve entrapment, etc., causing pain. So the diagnosis is different. So the treatment locations are different. So if there is an overlap of motor points and Chinese acupuncture points, nice, but you're probably not treating the same points for the same problem that I'm treating. In some forms of acupuncture, traditional styles, meridian based, you can knock out knee pain with needles in the thumb or the hand, or on both sides of the middle finger, perhaps. You could knock out the knee pain temporarily. It's pretty fascinating. I'd love to understand from neurology or an active MRI scan to see how that's actually working. But it's temporary. It's it's opioids. It's your body dumping a bunch of pain-killing chemicals that temporarily relieve that pain. And that could be helpful for somebody who's in a lot of pain. But what I'm doing is trying to correct the problem long term, not just relieve the pain. The pain will go away when the problem's gone. I'm trying to fix the structural problem that's leading to pain and inflammation or nerve entrapment, not just hide those symptoms. Because, frankly, people can take medications to hide their symptoms. They can get epidurals. They can do nerve ablation. They have lots of options. But if somebody actually wants to get back to walking upright and spending time with their family, they're not just looking for pain relief, because they'll pay a price blocking the pain and then going out and using that limb. Whereas I'm trying to fix the problem by resetting muscles that have become too tight or too weak, using electric stimulation of the motor points. So that's the difference. Okay, this is a long episode, but I'm glad it's there, because I really think that I should have considered making this type recording and explanation long ago. I've been doing this podcast for over a couple of years. So anyway, have a great one, and